Good afternoon. I'm George Latimer, Westchester County Executive, and this is our weekly Westchester update, Monday, November 29th. We're going to devote ourselves to the topic of COVID exclusively today with a couple of different elements to it. We'll be joined, of course, by Deputy County Executive Ken Jenkins, who will give us an update on some of the upcoming satellite locations for vaccinations. And then we'll also have the opportunity to hear from Dr. Sherlita Amler, who's our Commissioner of Health. We'll talk a little bit about the Omicron variant, which we've heard so much about in the last couple of days. We want to wish all of you who are celebrating Hanukkah a very happy Hanukkah, the Festival of Lights, now the second night ahead for all of our Jewish brothers and sisters. And we also hope that everybody had a very happy Thanksgiving late last week, that you enjoyed the companionship of friends and loved ones, preferably being safe with COVID protocols, but that we did enjoy what is a very important time of the year, very important American holiday of Thanksgiving. So moving ahead to the COVID situation, it's been very serious in the last few days as we have heard reports of a new variant coming out of South Africa, Omicron. That's the Greek 15th letter of the Greek alphabet. You may recall that Delta was one of the more recent variants, and there was an alpha variant in the beginning. So as with hurricanes, we're naming them based on Greek letters of the alphabet. Good time to brush up on your Greek. But Omicron has created, because of the nature of modern media, perhaps news, perhaps the fear of things that most of us don't understand in medical science, a tremendous dialogue out there, breaking news on each of the different cable news channels, and it's generated a real concern. And I think in this report we want to address where are we at in Westchester County vis-a-vis the COVID outbreak, and Dr. Amler will talk a little bit about Omicron, and then also some of the other issues that are at hand with pediatric vaccinations. But I think the first most important thing to discuss is the mindset that we as Americans, we as Westchester residents have to have going into this holiday season. As the weather gets colder, we're doing more things indoors, and we run the risk of greater exposure to this disease. We have now been dealing with COVID since March of 2020. We're just a couple of months shy of 2 solid years. And this, for us as Americans, is a new experience, this generation of Americans. Those of us, I'm in my late 60s, almost 70 years of age, we have not experienced the kind of societal sacrifice that other generations have. I grew up in a household of parents who went through both the Great Depression and World War II. And they understood that sacrifice was not just a short-term action that happened over a day or two or a month or even a year, but over an extended period of time. For those of you who have relatives that lived through the Depression and or World War II, for those who served in Vietnam in service, and many of the other great crises that we've experienced where we have living memories of them, these things play out over a long period of time. The American mindset of trying to have a solution to every problem at the end of the 1-hour TV show is satisfying, but it's not real world. And when you consider that it was a long road from Fort Sumter to Appomattox during the Civil War, those were 4 bloody years. I'm giving you a history lesson, which you already know, but it was 4 bloody years, and there were reverses, and there were advancements, and nothing was resolved until it was completely resolved. It took a couple of different mindsets. It took thoughtfulness, that we stay aware and awake and alert as we go through this difficult period of time, and it continues to go through this time. We show a great amount of self-discipline. When we're going through a crisis, we're not able to do all the things we'd like to do the way we'd like to do them, and it requires a self-discipline that can only come from within. We can mandate things legally to do certain things, but still the individual has to understand that there's a moment of self-discipline that comes when a crisis is at hand and extraordinary actions are required. And then also perseverance. The fact that you wake up tomorrow and you wake up the day after tomorrow and you wake up the day after that, and you have to be able to practice the same things that you didn't particularly care to do on the first day. But it requires perseverance to do this day after day after day, even when you don't want to. Now, for those who are children, they can react certainly through their level of maturity the way they do. But those of us who are adults don't have the luxury of being able to, put our thumb on our nose and wiggle our fingers in anger, or show that sense of frustration. And we have to show that strength of character every day, living every day. Our parents and our grandparents and our great-grandparents' generation have shown this as different crises have hit both America and the world. And we have to have that mindset as we go into understanding what this latest variant may be, as we look at numbers which go up, numbers which go down, It's much the way the stock market is. You cannot overreact on bad news. You can't overreact on good news. You got a steady hand. And that steady hand requires us to do things at times that may not appeal to what our ideology is. And there's a wide range of ideology across the spectrum. There are those who feel very strongly that stronger measures should be imposed automatically. They should be imposed universally. And they believe that that is the way for us to deal with this situation. If everyone believed the same thing as they did, that's what would happen in the society. But everybody does not in a free society believe that. There are other people, perhaps at the other end of the spectrum, who believe the exact opposite of that. They believe that this is not as serious a pandemic as has been expressed. They don't see its impact in their lives. They're frustrated and angry that they can't live lives the way they want to live it, and they refuse to do those things that represent any of that self-discipline. And if the whole world believed what they believe, then we would operate differently. But we're in a country with free opinions, free expression of opinions, and a range of opinions across the spectrum. And it's our responsibility, those of us who are in leadership positions, to try to find what is the right place to be that understands that there are extreme points of view, but there's lots of gradations in between. And we have to listen to professionals who know more than we do about medical science, and there are also a sort of common understanding of what the will of the people is and how far will people go to do certain types of things and not do other types of things. This general commentary, before we begin the specifics, is essential because you cannot assess the status of what we're in without understanding the total scope of what we are as a society, how we respond in this day and age to a crisis compared to the way it was responded to in past days. We have media that gives us information at a moment's notice. We can see incidences in front of us of things that are happening all across the globe, not just what's happening in our backyard. And all of those different inputs will affect the way we look at things here in our backyard. But the decisions we have to make in Westchester County have to be based on what is the status of this pandemic here in Westchester County. What are the things that we have to do in our square area of 1 million people to do the best that we can to fight this pandemic, understanding that there are things happening elsewhere in the country, elsewhere in the state, and elsewhere around the globe. And it's very important to put that mindset on. I'm going to share a few statistics with you to give you an understanding of where we are at this moment in time on this Monday, November 29th date. Numbers constantly move, circumstances change. And as those circumstances change, we will adapt and adjust our policies to those changes. But we will not overcompensate for what we think might happen, and we won't operate out of fear, we won't operate out of anger, and we're not going to operate out of ideology. We are not going to take people who believe at either end of the spectrum there is a mindset that must be applied. We're going to look at the facts on the ground to make those decisions. What are the facts on the grounds? The single most important reason why we make this effort to fight COVID is to prevent people from dying, fatalities. We have experienced to date 2,356 fatalities in Westchester County. It's important to understand that in the last 2 weeks, we have had a grand total of 2 fatalities, and over the last 3 weeks, 3 fatalities. I always mention, every fatality is an individual tragedy. It is not to be turned into a statistic. But to understand a trend line, you must understand what has happened, even with the increase in infections and the sort of moderate level of hospitalizations. We have had only 3 fatalities over the last 3 weeks. When a person sees a report on television, when they hear what's happening in the western part of New York State, or what's happening in another state in the United States, what's happening in another country, and they're doing this in Belgium and they're doing this in China. Here in Westchester County, we have had a very low, moderate level of fatalities now, even though we have had some increase in infections. It's important to understand fatalities are the single most important thing that comes out of this. We want to prevent fatalities. We want to prevent people from dying. The second most important statistic is hospitalizations. These are people who have the disease but have it at a severe enough level where they have to be hospitalized. As we speak today, there are 52 people hospitalized for COVID. And as a comparison, if you look back, we have a chart that gives some of these additional statistics. If you look back at where we were in August, 3 months ago was the peak of the Delta variant. Remember how much the Delta variant was hyped? The concern that the Delta variant was going to be much worse than the original outbreak. The Delta variant hospitalizations was slightly more than twice the number of hospitalizations we have today. 52 today. At its peak, 108 hospitalizations at the peak of Delta. Before vaccinations began, 1 year ago today, roughly, 1 year ago yesterday, November 28th, 2020, before there was vaccinations, we had 244 people hospitalized for COVID. So when someone tells me we're in a crisis situation, we need to react, we need to do certain things, I want to be sure you understand exactly what that situation is today. We have 52 people hospitalized with severe cases of COVID. A year ago today, we had 244 people hospitalized. What's the major difference? Now we have vaccinations. And vaccinations becomes the key tool to use. We have other tools. Social distancing is a tool. Masking is a tool. Hand sanitizing is a tool. But the single biggest tool that we have is vaccinations. Now, we understand in Westchester County, as of this moment in time, based on New York State Tracker information, adults 18 years of age and older, 92.2% of all Westchester residents have been vaccinated. In an average setting, as you walk down the street, every 10 people you see, 9 of them have started their vaccination protocol. Generally, that means they've had the first shot of a 2-shot protocol, or they have had both shots. We have not yet gotten statistics from the state that shows the booster factor, which is still very low, as they've just been introduced within the last few weeks. That 92% vaccination number in Westchester is dramatically different from other parts of New York State. We have a graphic that'll show you vaccination rates by county. I'd like for you to see that right now to make some comparisons so you understand when you are walking on the streets of White Plains or New Rochelle or Armonk or Bronxville, what setting are you in Westchester County? We're at 92.2% vaccination rate in Westchester County. Our neighbor to the west, Rockland County, 81.5% vaccination, under 10% less percentage of population. Orange County, 75%, 75.3% vaccination, and down the chart, I assume that's on the screen, 80% in Dutchess County, 86% in Putnam County to our north. They're the closest to us. If you look into New York City, which has had a restaurant mandate and other mandates for a long period of time, an employee mandate, Bronx County is 86.6% after 3 months of a mandate for vaccination for employees and mask wearing if you're going into restaurants. 83% in Brooklyn, 84% in Staten Island. Manhattan's and Queens numbers are higher than these. These 3 are the lower of the 5 boroughs, and Westchester is at 92%. We have reached in Westchester County, for a variety of reasons, a much higher level of vaccination of our population than the neighboring counties around us. Let's take a quick look around the state. Right now, in the western part of New York State, there are some efforts that are going to represent a mask mandate. Now, I think the graphic has reversed the 2 different areas. Look at the chart that shows Erie County. That is actually western New York, not North Country. Erie County is at 80.3. Monroe County at 82.2. Erie County is Buffalo. Monroe County is Rochester. Those are the 2 largest cities in the western part of the state. Both of those 2 counties are 10 to 12 points behind Westchester in vaccination rate of their population 18 and older. The smaller counties around Erie and Monroe County have much lower rates, 75% in Niagara, 61% in Cattaraugus. I know you have to go to an atlas to find out where these counties are, but they are all in the western part of the state. Allegheny County, 52%, Orleans County, 63%, Wyoming County, 61%. When I talked to my colleague, Mark Polenkars, who's the county executive of Erie County, a good friend and a very capable county executive, we talked about why he did mandates in his part of the state, and he pointed to the regional numbers that he has that are significantly below the regional numbers in the Hudson Valley. Why does that matter? Because the major tertiary care facility in western New York is in Erie County. People who are seriously sick in Niagara County, in Cattaraugus County, and Allegheny County, when they max out at their local hospital, are going into the major facility in Erie County. And that is the same that we have in Westchester County. The tertiary care institution, Westchester Medical Center, represents a 7-8 county region of people who might be sick at a certain level and need medical care beyond that which they can get at their local hospital. It is to the Westchester Medical Center in our county that they come to. So you look at those regional numbers to make a decision as to what you're facing. And what my friends in the western part of the state are facing are very low vaccination rates in comparison to what we're experiencing here. I also have 4 counties. It's listed there as Western New York. It's actually the reverse. It's North Country. That's the area in the Adirondacks. These are more rural counties. They don't have some of the larger cities that, well, some of them do, but most of them don't. Washington County, 71%. Rensselaer County, 78%. Montgomery County, 79%. Fulton County, 60%. If I've done nothing in this report but rush you to look at a map in New York State so you know where these counties are, there are 62 counties all across the state, and the ones in western New York are a couple of 100 miles away from us, 300 miles plus away from us. The ones north of us are anywhere from 150 to 200 miles away from us. They're not close to us, but they are experiencing much lower rates of vaccination. If vaccinations are the key tool to fight this COVID virus, that is why in Westchester County we are at 92.2%. It doesn't mean we rest on our laurels, but it does mean we understand where are we in the degree of urgency compared to other places. And it is the urgency that leads us to take additional actions, not ideology, urgency. And the urgency based on the amount of fatalities, low number of fatalities right now that we're experiencing, the amount of hospitalizations. Our hospitalization numbers are still considered low at 52. We have a total capacity of hospital beds in Westchester County of 2,700 hospital beds. That's assuming you vacate every bed and you make it available for a COVID patient. You don't want to do that because there are other legitimate illnesses that bring people into hospitals, heart attacks, strokes. You have elective surgery that people have planned for a period of time, knee operations and hip operations and a host of other things that are important to a person's health. So you don't want to empty all the hospital rooms if you can avoid it. But at 50, we're in a much better position than Western New York is. We're in a much better position than some of the smaller rural counties of the state is. And you need to understand that, because when you turn the television set on and you hear about Omicron, you don't really know, and I don't either know what it could be, but it could be something out of a Stephen King novel. It could be something that maybe doesn't, and I'm not sure, and what are we going to do, and we better do, and we've got to calm down. We're in a long battle. This battle is almost 2 years in the making, and we don't know how long it's going to be. And we don't want to take extreme measures until we know that they're necessary. And we have been getting good, solid compliance here in this county from the strategies that we've been using. Now, Governor has to have strategies that involve the whole state of New York. Her responsibilities are far greater than mine. And I don't purport to dictate what I think should happen in another part of the state. But for Westchester County, we're doing the things that have to be done necessarily at this stage of the game. And we will adjust depending on what happens in the numbers. If we see the numbers change, then we're going to make those efforts. Let me sort of lay out what Erie County has laid out. Keep in mind, this is how Erie County has laid it out. They've identified now a mask mandate for individuals in indoor settings all across Erie County. Buffalo, Lackawanna, Cheektowaga, Amherst, North Collins, if you know the geography of Erie County, the suburban towns, as well as the larger, more urbanized areas. The mask mandate is the first phase of what would be a more severe set of mandates if they're necessary. And the Erie County executive and legislature have not yet made any indication that they're going to move to the next level of severity. Right now, a mask mandate in Erie County, they're the only county outside of New York City that has any mandate in place whatsoever. None of the other counties have a mandate of any sort. The next level up, if the severity continues, would be vaccination requirement. Not a mandate to vaccinate, because those who don't want to vaccinate are going to be very difficult to force vaccinations. But a vaccination requirement, which is what you do see in New York City. If you go into a restaurant, you must show your vaccination card. I have it in my wallet. I've shown it whenever I've had a meal in New York City. I don't consider it very objectionable. Some people consider it extremely objectionable, particularly those who haven't been vaccinated. They believe this is an infringement upon their rights. It is the next step up from a mask mandate if the virus continues to spread like wildfire and fatalities and hospitalizations follow. And then what we saw already in the early part of 2020, we have no interest in going to the next levels at all either. We have no interest in going to the next level, which is the percentage shutdown of businesses, to say, no, you can only have 75 people or 50% of the people work in your workspace. And at some point in time, the ultimate thing that we did experience for a period of time in 2020 is a complete shutdown. These are more extreme steps, and the only way that the people of this state, of this county, and of this country will accept those things is if the crisis is so clear and present that we have such a level of fatality, such a level of hospitalization that it justifies those measures. So what I'm trying to articulate is that we are looking and assessing every day what are the steps that we need to have? And I've had conversations with the major business community organizations, Westchester County Association, Business Council of Westchester, to consult with them to see what input they might be able to give us. I've called fellow county executives, Pat Ryan in Ulster County, Ed Day in Rockland County, to assess how they're looking at the situation, to try to get an idea of exactly where we are and exactly what we have to do to best protect ourselves. Because the health and safety of our residents is the paramount responsibility that we have. But that also requires those residents to see this step as being a necessary and appropriate step. Otherwise, we will have the type of resistance that can give us civil unrest in this society. We don't need that. That doesn't advance our need. What we have to be able to do is take steps that are appropriate to the degree of the severity. Now, we've seen, since the vaccination situation has come on, a diminution in every one of those critical categories, in hospitalizations and fatalities and so forth. We saw today, and we're going to try to get these numbers on a regular basis. There are 52 people that are hospitalized right now in Westchester County due to COVID. HIPAA laws limit the amount of information we can know. But in checking, we have found out that 2/3 of the people who are currently hospitalized are either unvaccinated or unknown as to their vaccination status. In most cases, when a person is unknown, they are generally unvaccinated, because if you are vaccinated, you have a record of it and you're willing to show it if you haven't. Of that 1/3 of the people that have either gotten one dose, so not fully vaccinated, or fully vaccinated, we don't know, and we won't be able to find this out, how many of them may have underlying health issues for which the vaccination alone was not sufficient to be able to counteract. We all know the story of the death of Colin Powell, the general and former Secretary of State. He had been double vaccinated, but he had some very serious underlying illnesses, and ultimately he died. And in that particular case, the medical assessment was his underlying illnesses were so impactful to him that the vaccinations alone could not prevent the COVID infection from spreading. So we have to make sure that if we talk about a person who is vaccinated, what level of vaccination they're at and what level of other health that they're at in order to properly judge that circumstance. But to know that 2/3 of the people that are right now in a hospital are people that are unvaccinated, and they have chosen not to be vaccinated, and 2/3 of the people that are in the hospital today are there, we hope that they recover. We want them to recover. We don't want one fatality no matter what the circumstances are. But this is a matter of prudent risk. You take risk all the time. People will say you get behind a wheel of a car and you drive. Isn't that risk? Yes, it is risk. And what do? You make sure your car is in tip-top order. You make sure you don't have bad tires so that you run the risk of a blowout that could cause your fatality. You make sure that you put your seatbelt on so if you do get into an accident, your head doesn't go through the windshield. You make sure that if you're driving late at night and you're feeling drowsy, you pull over and have a cup of coffee or take a nap so you're not trying to drive through bad conditions. You use prudent judgment. If it's snowing or icy on the road, you drive slowly, or you pull over, you don't drive at all. You take risk, but you take prudent risk. You assess how dangerous is this for me to follow this course. I don't sit there and say ideologically, I'm going to drive tonight no matter what the weather conditions are, no matter what my physical conditions are, I'm going to drive tonight. You know, maybe some of the professional truckers are forced to do that. But for most of us, we make assessment on risk. And I think that is one of the key questions that deal with this. As we deal now with vaccinations, our strategy in Westchester County continues to be an active, aggressive role in making vaccinations available to everybody who is eligible. We still have, by the math, 8% of adults, actually a little less than that, 7.8% of the adults who have not yet been vaccinated at all at any level. We have the majority of those who have been double vaxxed still eligible for a booster shot to protect them to a greater degree. We also now have pediatric vaccinations so that those under the age of 12 that could not be vaccinated previously now can be vaccinated. And we're going to talk about each of those things in some of the reports that we have now. What we have now is an additional element of the tool that we did not have 2 months ago during the Delta variant. And we're just now starting to see booster shots in the last 3 weeks. We're just now starting to see pediatric vaccinations. So I'm not believing that the numbers that I see today are instantly going to rise if we have a greater degree of vaccination in these groups of people who were not vaccinated previously. But there's no guarantee that that'll be the case. The combination of holidays in the winter may still cause cases to rise. But that's what you make the decision on. You look at those factors and you assess them, and you reach out to your colleagues, you reach out to professionals, you reach out to people in the business community and the other communities to try to understand what would be the smartest, most prudent decision to make. To deal with the issue of Omicron, which is unknown to me and still unknown to most of the researchers, I've asked Dr. Sherlita Amler to join us. I'm going to ask her to join me at the podium now, give us a bit of an understanding of what this latest variant might be, understanding that she is not in the research laboratory right now as we speak, but she is here in the practical world of public health. Dr. Amler.
So, Omicron is a variant of the SARS-CoV-2 virus that causes COVID-19. This variant was reported to the World Health Organization from South Africa on the 24th of November. And on the 26th of November, just days ago, the World Health Organization designated it as a variant of concern. This variant has an unusually large number of genetic mutations. Several of these are novel mutations, meaning they've not been seen in previous COVID variants. And several of these genetic mutations impact the spike protein. And the reason that it's important is the spike protein is what the vaccine companies use to try to target the virus with their vaccines. There's an awful lot that we don't know about this new variant. More that we don't know than we do know, but over the next few weeks, a lot of information is going to be coming out and we're going to know a whole lot more. So right now, there's not a tremendous amount that I can tell you. More I can tell you about our concerns. Our concerns about this particular variant is, first of all, is it going to be more transmissible than the Delta variant, which, as we all know, was much more transmissible than the previous variants that came before that? A concern is, can this new variant escape the vaccine safety that was provided by the vaccines that most of us have taken? And so, can it cause infection in people that are fully vaccinated? This information is being studied, and we'll have that, I'm sure, in the next couple of weeks. We're going to have a really good idea how protective the vaccines are against this new variant. There is also concern that individuals that this mutation may impact the natural immunity provided to people who've actually had COVID infection. And so, again, we don't know if that's the case, but there is concern, and certainly scientists and doctors are looking into this in the field of public health. Currently, this new variant has been identified in 15 countries, including Canada, which is, as you know, on our border. There are no unusual symptoms that have been found to be associated at this time with this new variant. So the reported symptoms have been those that we've seen with the other COVID variants, such as fatigue, headache, and pain. So what can we do to protect ourselves? First of all, remember that currently in the United States, the dominant variant is still Delta. And so that is the major concern. And so we would still encourage everyone to be vaccinated. And if you haven't already been vaccinated, I would encourage you to do it as soon as you can. If it's been more than 6 months since you had your vaccine, I would encourage you to get a booster. If you have a child between the ages of 5 and 11, I would very strongly encourage you to get them vaccinated. Because right now, the number one thing still in our backyard is the Delta variant. The other question that frequently I've been asked over the last couple of days is, will the PCR tests that we use to determine if someone has COVID, will they be effective in picking up the new Omicron variant? And it appears at this time that it will detect it, and actually how we will know that we have the variant in our backyard, and if it makes it to Westchester, is by the fact that when people test positive for COVID, there is a sequencing that's done of that particular virus's RNA, its genetic material, and they're looking for variations. And so that's how we will know if we do get Omicron in our backyard, is by the people who test positive, the scientists having a look at that and trying to determine the RNA sequencing. So I think that the best thing that we can do, besides vaccines, is the things that we've been doing for the last 2 years. And, I know you're really tired of people, you're probably tired of me telling you, that you need to social distance. You need to wear a mask, especially if you're in large groups. And, wash our hands and just do all the things that we have done that have been successful at keeping our population as safe as possible over the last 2 years. And as more information becomes available, which it will, I'm sure the county executive and myself and my staff will be happy to share what we learn with you as soon as it becomes available to us.
Thank you very much. That's Dr. Sherlita Amler, who's our Commissioner of Health. She's been with us since the very first day of this outbreak. She was the one that talked to me in February of 2020 about what we were hearing happening in Wuhan, China, long before, actually in January, late January, long before it ever became on our scene. So we're very appreciative of your professionalism, Dr. Amler and the rest of the team of the Department of Health. Now, in the practical world of trying to provide those vaccinations for as many people as possible, you're aware that the state of New York determined that they would no longer have a mass vaccination site at the Westchester County Center, which worked well for us for a period of time. They have established a vaccination site at the Yonkers Armory, which was operative earlier in the year and now has become operative again. And we have 2 health clinics, which we've often mentioned, one here in downtown White Plains on Court Street, one on South Broadway in Yonkers that the county operates. They are not structured to be mass vaccination sites, but they are able to administer a certain number of vaccinations a day. So what we have found in our strategy has been to look at satellite. They're called pop-up in some areas. I tend to call them satellites. I think that's a better way to put it. Satellite vaccination centers that make it easy for people to get vaccinated. Now, they can be vaccinated at a local pharmacy. They can find information on our website, westchestergov.com. We'll give you some of that information. They can be vaccinated through their medical professional offices. If they're part of one of the major medical groups, they've been authorized to issue vaccines as well. But the county, working with school districts, are in the process of doing things for pediatric vaccination and further vaccinations. I've asked Ken Jenkins, our Deputy County Executive, to just run over with us what are some of the upcoming satellites that we have. Ken.
Thanks, George. And certainly, as both the county executive and Dr. Amler continue to remind people, and for the CDC and the World Health Organization and everyone that has an opportunity to continue to tell us, the best way and best protections for each and every one of us is for everyone to get vaccinated, and if you're vaccinated, to get boosted up. For the pediatric clinics, we've been working with the various school districts, and certainly out of 134 Court Street here in White Plains, and to do those pediatric vaccinations. We've also had tremendous partnerships with the Ossining Volunteer Ambulance Corps and Scarsdale Ambulance Corps to do those. Today, those are happening in Tarrytown from the Ossining Volunteer Ambulance Corps in the school gymnasium. So that's going to be today and tomorrow for first dosage for the pediatric vaccinations. Mount Vernon is having its second dose of pediatric vaccinations happening today. Tomorrow, New Rochelle will also have at the Webster School, that's at 95 Glenmore Drive, their first dose vaccination sites. Just want to continue to remind everyone, as Dr. Amler tells us, first they need to go on the Westchester Gov Health site to be able to sign up. You just can't walk into those particular sites. Those are very important things to do ahead of time. The rest of the week, we are having second doses at 134 Court Street, and that's open for the general public, but again, making sure to sign up at health.westchestergov.com. And Friday, we'll be in Tuckahoe at the Union Free School District in Tuckahoe, but 3 to 7. Again, making sure to sign up, taking a look at the website. As the county executive pointed out, and Dr. Amler also pointed out, many people everyone's eligible for boosters at this particular time, whether it's 6 months from your initial shot for, I guess, for the Pfizer folks, and Moderna, it's a less period of time, and Johnson & Johnson, even after 2 months for the Johnson & Johnson, if I recall correctly. We're having 2 sites this weekend. We're having on Saturday, the 4th, at 134 Court Street from 10 to 2 in the afternoon. Again, making sure to sign up, but you can walk into 134 Court Street. Just checking Dr. Amler to shake her head on that. And then again on Monday for booster shots. Again, those are booster shots for Saturday, and then again on Monday at 134 Court Street. Again, the best thing to do is check everywhere that you possibly can, whether that's your pediatrician, your personal doctor, the pop-up satellite sites, as the county executive continues to talk about, to make sure to get those opportunities. And there is the federal vaccination site where you can see all of the places that you are able to get those things. But again, the best protection for all of us is to get as many people vaccinated as possible. And for those that cannot, we make sure to continue to wear masks indoors. Thanks a lot, George.
And I want to thank our Deputy County Executive, Ken Jenkins, Joan McDonald, our Director of Operations, the rest of our operations team, because they have been on the ground handling all of these issues. There are other issues to talk about here in county government. We're not going to cover any of them today, but I would encourage you to reach out to the Westchester County Board of Legislators on their website. They are going through the proposed 2022 budget. They have a scheduled Zoom public hearing coming up, and they'll have a number of different special meetings to deal with it between now and what I think will be their close date 2 weeks from today. I encourage you to reach out and dialogue through that conduit. Also, we're reestablishing the coffee and conversation programs that were suspended due to COVID. That's where myself and a county legislator in a particular community go out in the community, spend an hour and a half at one of the local locations, and are available to answer any questions. Social distancing will apply, masking will apply. But we expect to start that again this weekend. We'll have a 10 o'clock session in the town of Mamaroneck, Larchmont-Mamaroneck area with County Legislator Catherine Parker. That's 10 a.m. at the VFW Hall on Boston Post Road on the Larchmont-Mamaroneck border. Then later that afternoon, 1:30, 2 o'clock will be at the Rye Recreation Center in the city of Rye. And then in the following weeks to come, we have a date scheduled in the village of Rye Brook with County Legislator Nancy Barr. We have a date scheduled coming up with County Legislator Mary Jane Shimsky in her district, and we'll do this all around the area again to get back to that contact. So we are trying to return to some degree of normalcy, but we will also take all of the precautions we need to take. And again, if we see any changes in what's happening out there, we'll be happy to deal with it. I'm going to check with Catherine Chaffee, see if we have any press questions or comments. Anyone from the press who would like to reach out to us, I know the governor is either speaking now or will be speaking shortly. You're welcome to reach us back, Catherine Chaffee at 995-2932. We appreciate you tuning in. Thank you again to Dr. Amler and Ken Jenkins always. And thank you for watching and thank you for listening. It's very important that we understand where we are at this point in time. We will get through this. We will get through this together. We'll get through this as an intelligent and as persevering way as we can by getting through the crisis that we face. We'll do it together, and we'll have that sense of relief when we pass through this at the end of the day. We will get there. Thank you for watching. Have a good day.